One.
Hello.
Hello there.
Hi.
Okay.
Second.
Yep. Go.
Hi everyone, I'm Rachel Shue, and today I'm going to talk to you about some of the popular antidepressant drugs, Zoloft, Paxil, and Prozac, and why we should not be prescribing them to young adults. Depression, according to the medical dictionary, is described as a psychotic or neurotic condition characterized by the inability to concentrate, insomnia, and feelings of extreme sadness, dejection, and helplessness. Before antidepressants came along, therapy was the most common treatment, and it was proven to be very effective. But now we have drugs like Paxil, Zoloft, and Prozac, which can be effective short-term, but prescribing them to children and young adults whose brains have not fully developed can be dangerous. MIT created the Young Adult Development Program in 2005 to try and understand the strengths and vulnerabilities of young adulthood. During this time, they studied changes in thinking patterns that affect behavior and changes in the structures and function of the brain that correlate with changes in thinking and behavior. What they discovered is that the very last part of the brain to develop is the prefrontal cortex, which is, this is the frontal cortex, and it'll be like this small area right here. It's the very last part of the brain to develop. The prefrontal cortex deals with problem solving, and it is not developed at 18 when you can vote, or at 21 when you can drink. The brain fully develops around 25. Now what does this have to do with antidepressants? Antidepressants work to increase serotonin and norepinephrine neurotransmitters and work to block other neurotransmissions that some believe may cause depression. In a fully developed brain, this process is not as dangerous, but messing with an underdeveloped brain in that way can cause serious side effects in adolescents that we are not sure they can recover from. We've all seen the commercials for antidepressant drugs like Cymbalta, Prozac, and Paxil, where an obviously depressed person talks about how they don't have the energy to go out and play with their kids anymore. Then their doctor tells them about this pill. They take it, and they're back to smiling and enjoying life. Then, as the commercial is showing happy family, a cheerful voice begins to list off the side effects at a very rapid pace. Side effects that may include, but are not limited to, dry mouth, constipation, vomiting, increased thoughts of suicide in children and teens and young adults, seizures, and muscle spasms. And those are not even all the side effects. The FDA has a full list of side effects of medications on their website, fda.gov. The FDA also released an article cautioning physicians, families, and caretakers to watch their patients carefully for increased signs of depression, thoughts of suicide, mood changes, and mania. The FDA has not yet linked antidepressants directly to suicide, saying that it is not yet clear whether antidepressants contribute to the emergence of suicidal thinking and behavior. The FDA has also ordered that more explicit labels be put on containers for drugs like Zoloft, Paxil, and Prozac. After reading all the side effects for these drugs, all of which may increase thoughts of suicide in children, teens, and young adults, there's a common question among physicians and psychiatrists. Is there really much benefits for adolescents taking these drugs? Child psychologist John Jureidini of the University of Adelaide, Australia, does not believe so. He and some of his colleagues decided to reanalyze the data found in 5 trials of Paxil, Prozac, and Zoloft. And they found that when you combine all the data, you see much less improvement. Jureidini states that the drugs have very little benefit and the possibility of significant risk should equate to a good deal of more caution in the use of these drugs. These drugs have been prescribed to children in the U.S. for more than 6 million times in 2002 alone. The popularity of these drugs seems to be diverting people from treatments that could be more effective, such as therapy. I'm not saying that we should get rid of antidepressants entirely, but they were not made for adolescents, and therefore we should not be prescribing these drugs to them. The risk factors are just too great when there are other safer options we can try. The end.